There's a condition that tends to be more common as we get older called Parkinson's disease. And we've probably all heard of it. But what do we all really know about it? Well, it's a progressive condition affecting the brain particularly. And it's the result of loss of cells in a part of the brain called the substantia nigra. These cells produce dopamine, and dopamine is a neurotransmitter involved in many things, including movement. The sort of symptoms that we get in Parkinson's disease include reduced movement, slower movement, perhaps a bit of a shuffling gait. You notice people with Parkinson's tend to shuffle a bit, they become much more rigid. They tend to have a tremor. In medicine we call it a pill rolling tremor. Their hands tend to shake, their fingers move around a lot. Now there are other features of Parkinson's as well, and that includes things like depression, anxiety, or problems sleeping. It comes on very gradually and may take many years to manifest itself completely. But when we suspect Parkinson's disease, then we should act quickly. The first port of call is specialist assessment with a consultant neurologist. Now in many parts of the country, you'll have not just consultant neurologists, but also nurse specialists that are being able to guide you through your disease. It's not too uncommon. About 2% of people over the age of 65 are found to have Parkinson's. So the chances are we probably know someone who's got it. Once you've been assessed and diagnosed with the condition, then the mainstay is medication. Treatment that helps replace that dopamine to some extent, to help with the movement and to help people maintain an independent and functional life as long as possible. Now, the progression of Parkinson's is very individual. Some people progress rapidly and some people very slowly. Some people are brilliantly controlled in medications, and for others it's a little bit more difficult. The long and the short of it is, if you have some symptoms of movement, slowing down, difficulties with perhaps communication, anxiety, depression, and you wonder if you've got Parkinson's, then come and see your GP. If we agree with you, then we'll send you to the neurologist for further assessment. Prompt diagnosis and prompt treatment can provide a good quality of life for many people. It should be said though that Parkinson's takes its toll on the individual and families, and a little bit like with dementia, it can cause a lot of disruption to people's lifestyles. You may need to think about getting extra care or support in your own home. You may need adaptations to your house to allow you to function well with an element of disability. You may even need to think about residential care in time, but these are discussions to be had with family and carers alike.